So our key strategies are really focusing on the racial concordance that every family will have access to a Black pediatrician and team. Our team-based multidisciplinary approach. We are focused on cultural humility and trauma-informed care, really being able to build out trusted, supportive, and healing relationships with each other and with our patients. We have a family lead who co-created clinic with us from the beginning. She is part of our leadership team. She also is part of our research and evaluation team. Everything gets run by her and then her families before we actually implement it clinically or in our evaluation. The staff wellness piece around healing the healers through art, mindfulness, reflective supervision, and celebration has been crucial. We meet with a therapist who is specialized in infant and early childhood mental health in order to make sure that we are as healthy as we can be so that we can show up for our families. Reflective supervision is not often a part of clinical practice from a medical perspective, and bringing in the infant child mental health specialist in order to help to support the team has allowed us to get through our days without being completely burned out and traumatized through vicarious trauma. And then something that's amazing that happened is the workforce development piece, where we're really cultivating future leaders. For the first time ever, in as far as we know, we now have 13 Black identified residents in our program, and we really want to be able to support their journeys so that they can graduate, be healthy and whole, and then scale the work. Next slide. Our guiding principles are really focus around being with, and this idea comes from Circle of Security parenting around sitting with each other and being that open, strong, positive, nurturing force for each other and for our families. We work closely with Vital Village out of Boston, and this is Dr. Renée Boynton-Jarrett and Rhonda Alexander, in order to protect and defend and heal the dignity that's inherent in everyone. Our focus is on soul care for our patients and our staff, and as I had mentioned, reflective supervision. Next slide. So this is an example of our soul care, our time with Toby. Toby is our infant child mental health specialist. You see her in the middle with the flowers. And I tell you, those infant child mental health specialists are incredible. And she has an ability to hold this amazing, diverse team. Next slide. Workforce development. So these are some of our residents that we're working with. We have so many different types of learners that want to be involved in the early relational health space. We have volunteers, intern, early career faculties. I'm really proud to say that we are working with graduate medical education to create racial affinity groups for our residents that are part of Bloom. We are trying to create curriculum for a Bloom elective as well as a Bloom residency pathway. And then scholarship is hugely important, both qualitative and qualitative research in the form of QI, but also IRB approved research studies where we're working with local birthing hospitals to really be able to think long term about how clinics like Bloom are impacting health outcomes.